And here we go. This is what a head CT looks like. Just wanted you to see that. YouTube's great. It has different things on it. So that's your head CT. Go back to our slideshow. Now you've got to end your exam. So you're going to click on this button right here. And you've ended your exam. Now let's go over some things, some anatomy that you'll see, and some pathology that you'll see when you do a head scan. Here's levels. You're going to see the cerebellum, the medulla pons. You'll see sinuses. Sinuses are right in here. Skull base right here. Foramen magnum right here. Again, you have skull base and different sinuses. And as you go up, here's the area of the circle of Willis that you would see. These are your ventricles. And here is the area where you will find your basal ganglia. You have white matter in here, and your gray matter is towards the outside. And here is some pathology that you might see. This is an epidural hematoma. You can see it right here and right here. You have a subdural hematoma. Again, let's see what it looks like. This is intracerebral hemorrhage, and this is bleeding on the inside of the brain. And this is blood in the ventricles. This is a subarachnoid hemorrhage. And this is what a tumor looks like. This is a stroke. The one on the right-hand side is a massive stroke. And this is hydrocephalus. This is enlargement of the ventricles, too much fluid, too much CSF. This is what a skull fracture looks like. Now we'll move on to the soft tissue neck CT. Now, a lot of the information that I've given you before is going to be the same. You're going to be using the same buttons to position, but the patient positioning is going to be a little different. Let's take a look at a little video. Again, the patient is going to be supine, and they're going to go in head first, but you're not going to use the positioning pillow. You just want, as you could see, a little roll underneath their neck to give their neck some support. And you want the patient's arms down by their side. And you may want to use the straps to give their arms support. Again, using the same buttons to move up and down and back and forth. But this time when you position the patient, instead of using the orbital meatal line, you're going to use the synovial notch. So the patient goes a little bit further into the gantry. You're still centering on the mid-sagittal plane, and you're still centering right around the EAM coronally. And let's take a look at that. There we have a patient on their back and their arms down by their sides. This is what it looks like to have that little neck roll. Again, you're going to do your scouts, and we don't need to go over again what buttons and stuff that you push, but if you have any questions, again, look up here, synovial notch, head first, patient supine, and you're going to click on your confirm button. And here's your protocol. Again, you'll go to your localizer, and you'll localize where you will be centering on the mid-sagittal plane. Your localizer will go up to the top of the EAM, or from the top of the EAM to the aortic arch. And you will center on those, both on your AP and your lateral, but there's no angulation for a soft tissue neck. Probably add some stuff to that.